Saavedra, and I'm with Clintuition, an intuitive way to practice medicine. So I have one co-founder in the back, Jared. The other one is Stephen Bradwell. He is one of the co-founders. So Jared is the finance guy. I'm the CTO, and Stephen is actually a doctor and professor at Vanderbilt. He's a pediatric doctor. So this is what we've been working on for about the last part of the year. Clintuition is an AI-driven platform that lets residents or medical professionals of any kind jump on and actually have simulated patient encounters with simulated patients. So we're still in the early stages. We're always evolving. We're definitely open to any feedback. And yeah, you could definitely help shape the future of medical training. So a few different features of Clintuition include a personalized patient creator. I'm actually going to show you guys how we create a patient. We put it together, and then you can actually, with the patient you've created, go in an encounter with them and try to diagnose them. The encounters themselves are natural conversation. You can perform physical exams, order diagnostic tests, and even ask the Clintuition platform for next steps if you're confused as to what to do next. So you also get real-time feedback. After every medical simulated encounter, you get a diagnostic skill assessment. So if you got the diagnosis wrong, we'll kindly tell you. And the clinical management evaluation and just communication skills. So you could get the diagnosis completely correct, but deliver it in a terrible way. So we'll definitely take that into account. So moving on, we have a patient we have created that you can actually try and demo towards the back is Emily Thompson. She's a 17-year-old white female who presents with shortness of breath. Like a lot of teenagers, she likes to vape. Is that on there? Okay, that's in the database somewhere. But she really wants to attend the school play tonight. She has some shortness of breath, and she's pretty worried because her inhaler is not working. But she's leading in the school play. She did not miss it. And yeah, so we can also describe what her physical exams will look like, her diagnostics, and as you can see here, her diagnosis is a pulmonary embolism. That I probably did not say that right. But here is the patient creator. As you can see, there is nothing set yet. From here, we can actually select the race, personality types, values, goals, location, etc. So after we fill all of this out for Emily, we can actually preview what that encounter is going to look like. So this is really great for providers or institutions that are looking to train their new medical professionals. So you can actually after you create the patient, you can actually go to this universal page. You can send it and share it with anyone to actually start this encounter with Emily. So once we start the encounter, this is actually my colleague, Dr. Bradwell, starting this encounter, and you can actually see that you're getting real-time answers from this patient. So she says she came in because she suddenly started having trouble breathing. When asked when it started, she says it started suddenly about an hour ago. And you continue to do this. You can then also do, you can ask Clintuition, I don't really know where to start. So we can ask, what questions should I ask? And from there, you'll see that there's then a list provided from Clintuition that tells you in detail where to go next. This is definitely beneficial for medical residents and yeah, just anyone in training, or even a doctor that's really wanting to hone in their diagnostic skills. So up next, we can actually perform exams. So in this scenario, we're going to do multiple exams, such as vital signs and a general appearance exam. Several others, so excuse me while this list is finished. But you'll see real time the results of all of these exams and orders, which then will help you figure out what the diagnosis of Emily or any of your simulated patients are. So after a long list of all of these exams, we're going to perform them. And as you can see, it then spits out everything you need to know to continue diagnosing this patient. After an encounter, you get assessed on your diagnostic skills, communication, etc. And really, what we're really trying to prevent is fatal diagnostic errors and increase the communication skills of medical providers, residents, etc., and just really trying to improve clinical medical training. So, wow, I really went through that. Okay, I'm a little nervous. So, you can actually scan this QR code right here and start the simulation with Emily Thompson. You're also more than welcome. We have 2 iPads back there to do a demo with any of our simulated patients. While the simulated patient encounter is really cool, what we're very excited about is being able to create these, any kind of patient, any kind of diverse patient. So what do we do, right, when someone they need a blood transfusion, but they're a Jehovah's Witness, right? These are all things, I don't know if that's appropriate, but, those are very serious things, that we need to consider, and a doctor may have never experienced a situation like that. So it's just really important that our medical professionals know how to react in situations like this. So, yeah, I probably did that in like 2 minutes.
No, you got 6.